Hi, I'm Caren Harris. I'm nurse with Pediatric Quality and Safety, and I'm here with Dr. Lindsay Carter, who's our Director of Inpatient Pediatric Quality and Safety. Hi, Lindsay.
Hi,
welcome. We're here to really talk about what matters to you. It's a movement that was started actually right here at MGH, right?
Mm-hmm.
Back in 2012 when Susan Edgman Levitin and Mike Berry wrote an article in the New England Journal stating that maybe we'd serve our patients better if we ask the question, what matters to you, in addition to what's the matter? Why are you here? So I know that there have been some international celebrations over the last 5 years, and Mass General came to that international celebration this year. Can you tell me why this year for MGH?
Sure. It was all about the timing. A group of us at MGH heard about what matters to you at the Institute for Healthcare Improvement's National Conference in December. Jason Leach and Derek Feely presented. And at the time of the presentation, we were really struck by how meaningful and important this felt. We thought that it aligned really well with what MGH was already doing with the focus on eye care around patient interactions and the focus on decreasing staff burnout. So we decided to, in pediatrics, we partnered with the Office of Patient Experience, the Stokel Center where Susan works, and Interpreter Services to coordinate the first kickoff event that we held in June.
Oh, that's awesome. So what exactly is what matters to you?
It's a question we get a lot. The way we explain it is a simple but important concept that we think builds trust and empathy and respect among providers, patients, and families. When you ask someone what's important to them, what matters, I think it allows us to improve the care that we deliver because we can align the care with patient preferences. And when you ask a colleague, I think it can help build teamwork and also makes work more fun, I think. But eye care, which MGH has been promoting, is about compassion, advocacy, respect, and empathy. What matters to you fits right into that. MGH has been doing person-centered care and family-centered care forever. This is a piece of that, I think maybe a formalization even more so of that. The tagline is ask, listen, do. Ask what matters, listen to what matters, do what matters. And sometimes that request is really simple and we can meet that right away and it just makes the patient's day better. And sometimes it's a really profound revelation that can significantly impact care. But I think regardless, it's information that helps us personalize the care that we do and also improve the work environment for everybody.
Nice, nice. Do you have any suggestions to how clinicians can incorporate this concept, this movement, into their everyday practice?
I think there are so many ways to do this, and it really depends on the provider, the patient, and the setting. But in pediatrics, we've developed bedside forms, and so these are displayed in the room on the inpatient wards and filled out by patients and families when they get here. It's been a really nice resource for staff as they come into the rooms to get that information right from the beginning, and it's been able to start nice conversations or learn something that we didn't know before. But that question can be, what brings you joy? What makes you happy? What do you not like about being in the hospital? What are you most scared about upon discharge? In the clinic, what do you hope to gain from this visit? I think the question itself isn't as important as just asking a question.
So how you phrase it doesn't really matter.
I don't think so.
To what matters to you.
Right.
I think it's an amazing concept, and I really look forward to hearing how people are incorporating it into their daily practice and being able to celebrate that on an annual basis going forward.
I agree, and we are really excited. We're already starting preparations to celebrate next year's What Matters to You Day.
Looking forward to it. Thank you, Lindsay.
Thanks.